Colorado could become the first state in the entire country to start importing prescription drugs from Canada.
The governor's office wants to solicit bids from Canadian wholesalers and importers that would be in charge of packaging and distributing those drugs. The state estimates savings of more than 60% on average for more than 160 different drugs. CBS 4's Sean Boyd now is live in Denver. Sean, this is a major undertaking.
Yeah, and Michaelia, safety has really been one of the biggest concerns. But check out the label on any one of your prescriptions, and chances are it was made in another country. Experts say 40% of our medications are made someplace else. 90% of the ingredients come from another country. The only difference, we pay 4 times what those countries do for the same drugs.
I call them shotgun migraines because it feels like I got shot in the head.
If Bonnie Arnold's migraine headaches weren't torturous enough, the cost of her prescription medicine was equally so.
And they told me it was going to be $600 just for that month's supply. I wanted to cry and I wanted to yell at somebody.
She became angrier still when she learned the same drug cost a fraction of the price in Canada. Her story, one of thousands like it in Colorado, and why the state is moving forward with a plan to import drugs from Canada.
We're confident that what we are putting together, it works within the guidelines that have been established by Canada.
Kim Bimstetter, head of healthcare policy and financing for the state, says Canada's shortages are in generics. The savings, she says, are in brand name drugs. She says Coloradans would save on average 63% based on 50 drugs the state compared. The EpiPen, for example, costs 65% less. A Flovent inhaler, 87% savings. And Synthroid, used to treat hypothyroidism, is 93% cheaper in Canada. Cheaper still in France and Australia.
Our consumers and employers are paying 20 times more the price than Australia is for the same thyroid medication. That's not okay. So we want to take the same drugs with the same FDA approval and just bring them in through a different pathway that allows us to bring so much more savings.
And life-altering relief for those like Arnold, whose migraines can last for months.
It would be life-changing.
Now, Kim Bimstetter told me they are still working on exactly which drugs to import. They sent a list of 167 drugs in their draft proposal to the federal government, which does have to approve this plan before it begins. The goal is to hire a wholesaler and an importer by the end of this year and to begin importing the drugs from Canada by 2023 at the latest, and maybe even from France and Australia, too. Some laws would have to change to make that happen. Everyone in Colorado, every individual, employer, and insurer would be able to access those drugs. Live in Boulder, Sean Boyd covering Colorado First.